Remar nurses, welcome, welcome, welcome. It's our favorite time of the week. It's Monday. Today is Monday, so you guys know what it is. Little thing we do around here called Let's Talk NCLEX / Monday Motivation or Monday Motivation / Let's Talk NCLEX whenever you decide to join this video. But you are in the right place if you're studying for NCLEX because this is a family. We're all studying for NCLEX. We're all on a mission to get our nursing license so we can work in the United States or any of our other territories. If it's your first time, I'd like to welcome you to Let's Talk NCLEX / Monday Motivation. And my name is Regina MSN, and I am your very biggest fan. I'm cheering for you all the time. I also happen to be the #1 NCLEX instructor on this planet, and I have the #1 students right here at Remar Review. You know, Team Remar is totally about your journey. Like, we just want to be a part of it. So whatever we have to do, we do it. And one of the things that I love to do is I love to be in your homes. I love to be in the phones. I love to be encouraging you guys, don't give up, because this is a journey for real. But you gotta stay disciplined. You gotta stay motivated. So today on our program, we have our Monday motivation topic is, what is the next plan? What is the next plan? And you guys know, I love to bring motivation from my own experience as a nurse, as an educator, as a mom, a wife, all these things that I am, right? Same thing as you guys. So what is the next plan is so it's just good. It's just good. I've been using it to motivate myself today. But as a part of Monday Motivations, we always bring real live testimonials. So good morning, everybody. Shout out to the nurses that are coming on here, knowing that we have Monday Motivation and saying, hey, I passed NCLEX. Tell us all about your testimonials. Today is the place because people love to read those in the comments. Don't be afraid. Put your testimonial in the comment today. And don't forget, guys, we got to share this video. Part of the comment process is comment and share. Comment and share this video. That will help us to unlock our NCLEX questions at the end. But you know what? Another thing I love to do for you guys is I love to bring testimonials. And I actually have 3 testimonials on this Monday. I have Nurse Esther, Nurse Dwayne, and Nurse Tamika. And I'm going to start with Nurse Esther. I just want to read. She actually did a video. But her words were so good. I'm just going to read them to you guys. She says, and I'm quoting, with God and Remar materials, NCLEX is possible. As a foreign nurse and repeat test taker, I love everything about Remar. Regina and Mark are special. They have what you need to pass NCLEX: motivation, spiritual, generous. In my mind, I saw NCLEX as an ocean too big, which gave me worries rather than focusing on learning. But when I watch Regina's NCLEX as an ocean with lots of opportunities that can change lives, I tuned my mind to that. So Regina's positive thoughts helped me. Even after passing NCLEX, Regina still provides support on how to be a great nurse. This is why I will continue to be her follower. I am a Remar nurse 2019. And I remember that. So she said, I love this because she says that she saw NCLEX as this huge ocean, like a huge ocean, and it gave her worries because when you think about the ocean, it is like overwhelming. It encompasses you. We actually, when we were on a cruise ship, we looked out at the ocean and it was literally covering us, surrounding us. And Mark was like, it's time to do a video. So I'm like, let's do a video. So we turned that thing around and I said, look at this ocean. Look how big it is. This ocean represents all of the possibilities that you have once you pass NCLEX. This ocean represents your potential as a nurse. You can do anything. You can take your nursing career anywhere. So Nurse Esther said she took that thought And she turned that thing around to where it made her excited and positive about this journey that you guys are all on. So I love it. This is a Remar nurse coming back to us and saying, hey, I'm an international nurse. I'm a repeat test taker. I can do this, and so can you. I love that messaging. So we also have nurse Dwayne Yet. She says, I beat the NCLEX beast my first time, 75 questions. God is good all the time. She is in our Remar for NCLEX. Yes, on the Facebook page, she posted that. And then also on the Facebook page, thanks to Remar for NCLEX, I passed. Got those official RN results. Love seeing that. You can now put those big letters behind your name. RN, registered nurse, PM, practical nurse, whatever it is, it's yours. It is yours. Don't forget, guys, we love these testimonials. Go ahead, pass NCLEX. Tell us your story. The videos are, I can't even tell you how far your videos that you guys send, how much they mean and how far they go to somebody who woke up this morning and really didn't feel like it. And when I say don't feel like it, I mean, they didn't feel like a nurse. They didn't feel like somebody that had went through nursing school and graduated, to be a nurse. People just, they don't feel it in themselves. They don't think that they can be it. And so they don't try. But when they see you, and shout out to all the nurses, congratulations, passing NCLEX. When they see you, an international nurse from Ghana or Nigeria or the Philippines or Puerto Rico or Taiwan, wherever, all the nurses that we have nurses in Russia, we have nurses all, literally every country, Canada, representing constantly. If you guys, I wish I could show you our map. And we just have little markers about where our products go. The map is insane. I'm gonna post a picture of it. Like, our map is insane of the nurses that we have representing Team Remar. So you guys just don't know how one of your countrymen can be watching and be so motivated through all of the process and the paperwork, the English requirement tests, the paperwork, tracking down their school. Like, there's some people's schools, they've been out of school for so long that their school doesn't even exist anymore, and they're in an international country. And so I just can't tell you guys how much your stories resonate to us. And it motivates me so much that I continue to want to do different types of programming for you guys. So I have a super announcement. I'm so glad that you guys are seeing this. Guess what, guys? I am bringing back Remar Nurse University. Yes, I am. You can thank me now. Remember Remar Nurse University, how amazing it was in May when we did it for a whole month? Well, guess what? It's coming back. So I got to tell you about it. And listen, you got to sign up for it, because if we do Remar Nurse University, it's free for you and you can participate. So we're doing Remar Nurse University. This is a special one for me. It's kind of a back to school event. The date is going to be a Sunday, September the 15th. And check this out, guys. I'm doing NCLEX and I'm doing TEAS preparation. Mind blowing. Some people are like, what is the TEAS? Oh my goodness. The TEAS is the entrance exam for those individuals interested in nursing. So guess what, Remar family? We're growing. Because now we're going to support every individual that wants to become a nurse. We're going to support these young ladies and young men to get into our field by doing TEAS preparation. And TEAS, one thing about the TEAS, just this, I know this is Let's Talk NCLEX, but this is about to be Let's Talk TEAS for 1 minute. One thing about the TEAS is, if you think that NCLEX is hard, TEAS, in my opinion, is 10 times harder, because let me tell you the subjects on TEAS, okay? You have math, and not just any kind of math. You have algebra, you have geometry. I mean, math is challenging enough, but this exam requires you to do that 7th grade, 8th grade math, where you're finding the area of a square or the radius of a circle, or you're doing rates. If if a train is going 50 miles an hour for 270 miles, when will it get to Hawaii? Like, this is the kind of math that's on T's. So our nurses, our little Remar babies, they are struggling, okay? This test also has reading, where you have to read a long paragraph and find the main topic, find the metaphors, identify the metaphor, so I've been preparing a review for this exam. The science goes back to, looking at the periodic table, breaking down elements, what is the main function of a cell and the purpose of a nucleus, and what do the ribosomes do? Like the anatomy, the science portion of it, laws of heredity. Like, what else am I missing? It's so tough. Can you imagine sitting down in front of a test right now and somebody telling you to find the area of a triangle? Would you be able to do it? Do you know those formulas in your mind already? Chances are you don't. So when we have adults who want to enter into nursing, but they have to take this exam before they can, before nursing school will even look at them. And so we're going to provide them with an NCLEX review. We're going to provide them with a quick facts, just like we do for NCLEX. We're going to do this for T's now. So tell a friend. It's going to be big for us. And we are doing it. The first launch of it will be for the back to school event. All right. So we're going to have that T's program rolling out. And I'm just so excited that the family is actually growing and we're able to make this impact into nursing. So that event, again, will be September 15th. Now, it's in my hometown. So my hometown, the live class will be in Youngstown, Ohio. So if you're in the Cleveland, the Akron area, Toledo, Columbus, hey, let's do it. Let's come together, and we are going to spend the day together. But also, guess what, you guys? My viewers in Florida, Ohio, Tennessee, Minnesota, California, Texas, Nebraska, Boston. I know Boston was the city. But listen, don't feel left out, because you can also attend this online. We're going to be streaming it live. So people are already signing up for this. They must be visiting the page daily. RNU, yep. So sign up right now, remarnurse.com/RNU. And you guys know how we do. When you sign up for an event, you get a workbook. And the workbook is what we will be going over during that event. So go ahead and sign up. I promise I'm going to send the workbook out. It's not finished yet. All right. I'm still deciding what topics I will be covering, but it's going to be good. It's going to be so good. So definitely make sure that you sign up for that event. Let me give you where to go to sign up. You can go right now. All right. So it's remarnurse.com/RNU. And this is for our Remar Nurse University back to school event. It's going to be a good one. Also, don't forget, Remar Nurse is also a code on the website. So if you go to remarnurse.com and you want to purchase a product, you can use the code Remar Nurse. Hey, and that's going to get you a sweet discount off of the Remar products. I am just so excited of the things that we have coming up. And it just speaks to the family and how we are literally growing. And when nurses pass and give back to the community and pass and give back to, us here at the company, we can expand and do major things. And I tell you guys, the most important thing that you guys do for us is prayers. The prayers that you guys send myself and Mark and the team, and the prayers that we pray for you. It's just like I don't even know what to call this thing, but it's like blessings go up and blessings come down, and prayers go up and blessings come down. That's better. Prayers go up and blessings come down. And that's what's happening right here at Remar Review. So thank you guys. It's definitely a humbling process. I can't tell you how much I love you guys. So we are going to get into our Monday motivations. That was the preliminary introduction period, the orientation period to the process. Now it's time for you to get your Monday motivation. And the motivational thought today, I told you, is there is no plan B. Okay. So the idea was, okay, what's the next plan? So what's the next plan is the idea is if this thing doesn't work for me, what can I do? Okay. If I don't pass NCLEX, then what can I do? I can go back to working at, Chick-fil-A, or I can go back to just being a nurse's aide, or I can go and use a degree in psychology, right? What's the next plan? Well, guess what, guys? There is no plan B for you. There is no plan B. You are supposed to be a nurse. That is what you're going to be. Because you know what? Once you doubt yourself, you have already failed. And that's just a truthful point. That's just a truthful point there. And for me, to be honest with you, I'm coming on here every week to tell you guys that there's really no secret to success. There's no easy way to do it. The way you do it is it's a daily sacrifice. It's a daily giving up. It's a daily grinding. And you know what happens? Those days add up. Those days begin to add up, and those days become weeks. And what happens during that process of you being in the mindset that, this is hard. This is not something that I'm going to be able to easily accomplish. But what happens is during the process, your mind begins to change. You begin to become disciplined, and you begin to honor all the hard work that you have put in, and it begins to add up. It creates this mentality that I can do this no matter what. And what happens is you no longer have a plan B. Some of us, what's holding us back is that we have a plan B. And that's the problem, because every time we put a thought into that, plan B, then that takes away from a thought for the plan A. Like the plan B, whatever it is in your life, is just a safety net. So that you feel like, if this thing doesn't work out, I'm going to still be good. But I'm going to tell you, if this thing doesn't work out, you're not going to be good. You're still always going to want to have a desire to be a nurse, because that's what you're trained for. And that's what your calling is. So every time you see somebody walking by in a pair of scrubs, you're going to feel some type of way, because you're going to feel like that should be me, because it should be. So today, you have to understand that if you have any kind of safety net regarding this NCLEX, that's what you're going to fall back into, right? So I have to encourage you guys to get rid of plan B, whatever it is. Like, I'm really nervous. I'm really nervous about being a doctoral student, right? Getting your PhD is hard. It's challenging. There are in my class right now, there's 6 of us getting their PhD, and there's 20 people getting their DNP. All right. So the doctoral nursing of practice, the DNP, that allows you to have certain privileges as a nurse, but also the schooling for a DNP is only 2.5 years, right? And you can get your DNP. For the PhD, it's a long 4 or 5 year journey. We have to take 20 more classes than the DNP. And quite frankly, I'm afraid, okay? I don't know if I'm going to be able to manage all of this and do REMAR and homeschool my daughter and be a wife, all these things. But guess what? I don't have a plan B. I don't have a plan B. It's either I get my PhD or I get my PhD. So I'm going all in on this thing. And you guys may see me, and some days I may look terrible and raggedy when I come here on Mondays, but just know that I'm in plan A still. And so that's what I want for you guys, because if you guys think that it's going to be easy, it's not. It's not going to be an easy process. So there was actually some studying done. When you go for your PhD, all of a sudden you have to be really interested in nursing, in nursing research, and you have to be looking up things constantly and having your facts right. So I'm loving it. I'm loving it. But there was a study done. I'm going to show this study to you guys. There was a study done where basically they had 2 groups of people, and they gave them a really hard puzzle to do, right? So they gave them a really hard puzzle to do, and they prepped one group. Okay, this was the backup plan group. And the backup plan group, they said, you know what? If you can't figure out the puzzle, we'll give you a backup plan. Okay? So what they found out was everybody who was given the backup plan, the majority of those people did not finish unscrambling the puzzle, because they were like, this is too hard. I can't do it. What's the backup plan? Give me the backup plan because I can't do this. But those who didn't have a backup plan, they successfully unscrambled those things because they were like, yo, this is the goal. This is what I came here to do. So this is what I'm going to do. And I thought that was so relevant to us because it's like when you don't see any other way, when you don't have an escape route to the left or the right, you just go forward. You're like, this is the only direction I have to go in. I have to keep going in this direction. But if somebody says, hey, if you look over to here, if you look over to your right, you can exit through that way, then guess what you're going to do? You're going to be like, oh, it looks kind of difficult up here. Let me go over to this way. And so that's what happens. And man, I just cannot express to you guys enough. Whatever the plan B is, if it's staying at home or, if it's looking for another job, get rid of it because it's not going to help you at all. It's not going to help you. There are no secrets. Success requires hard work. Success requires hard work. And I saw this quote. And it's a quote from one of my favorite actors. Anybody who knows me knows I really like Will Smith's movies. I just like him. I think he always picks good scripts for himself and his character range. Except for Wild Wild West. Wild Wild West was not a good movie for him. But otherwise, I believe this to be true. And it says, you have to believe it. There is no reason to have a plan B because it distracts from plan A. And that is the TR truth. That is the TR truth. All right. That you got to stick with the plan A because your plan A is what you want. It's like the highest level that you see yourself. So even past NCLEX, some of you guys see yourself, you want the PhD in nursing. Some of you guys want to be a nurse practitioner. You want to be a nurse anesthetist. Keep your plan A because it is very good. And some people are like, no, Regina, we just want to pass NCLEX. That's all we want to do. And I get that. That's cool. But whatever it is, stick with your plan. Now that your motivation has been served, I hope it was helpful. Now it's time for us to get NCLEXing. Let's do these questions. And remember, our share goal, 100 shares. That's what we're going for. And that will get you all 7 questions that I have prepared for you. But if not, we'll just do the 4. So let's get NCLEXing. Remar nurses. The first question, I love it. It's a good one. It says, a new graduate working on a medical unit during night shift is concerned that the charge nurse is drinking alcohol on duty. On more than one occasion, the new graduate has smelled alcohol when the charge nurse arrives for morning report. Which action should the new graduate nurse implement first? Number 1, confront the charge nurse with the suspicions. 2, talk with the night supervisor about the concerns. 3, ignore the situation unless the nurse cannot do her job. Or 4, speak to the nurse educator about the problem. What sayeth you guys? Oh, this is so good. Hey, what do you say? Should that nurse? This is a tough one because you know what? The nurse, this is a new nurse. And sometimes you have issues when you have to assert yourself as a professional because, the charge nurse probably has more experience, probably knows more. So this is getting into kind of like, what is the best practice for new graduates in this situation? See a lot of answers on the screen. Go ahead, answer, smash that share button. Remar nurses. I'm going to give you the correct answer right now. I think most of you got it. I think most of you guys know what's the best thing to do, but this could be kind of tricky. The thing to do is going to be number 2. Of course, you want to talk with the night supervisor about the concerns because the night supervisor the night supervisor is going to have the authority to evaluate these claims. They can say to that charge nurse, hey, the night supervisor can say to that charge nurse, I need you to report to employee health and do a toxicology. You know what I mean? They can have her do an alcohol breathalyzer test. Or they can, whatever. They can call that nurse in for an evaluation. So that is going to be the best bet for the new graduate nurse to pick, especially for NCLEX. Remember, we can never confront. You can never confront. Okay, we never confront our coworkers. Number 2, question number 2 says simply this. The registered nurse hung the wrong intravenous pain medication for the postoperative client. Which intervention should the nurse implement first? You give the wrong medication, what do you do first? Number 1, assess the client for any adverse reactions. 2, complete the incident or adverse occurrence report. 3, administer the correct intravenous pain medication. Okay. Or 4, notify the client's healthcare provider. I always get mixed answers on these kind of questions. And I know I'm going to see them on YouTube. I know that I am. But this really comes down to a matter of if you know your priorities as a nurse. What is your priorities? What is the first thing that you do? And this is one of those very important NCLEX questions, because this will identify whether a nurse is competent in the nursing process and whether she has great critical thinking skills, because administering a wrong medication can be a common occurrence, actually, for the new graduate nurse. So what should she do? And most people can get it down to 2, if I'm just being honest. Most people can get it down to 1 and 4. Some people choose 3. Some people do choose 3. But it's between 1 and 4. So out of those 2, what is the correct answer? Is your priority to assess the client, or is your priority to notify the client's physician? What do you say? Okay. So the correct answer for everybody, and thank you for participating. I do think that it's helpful. The correct answer is going to be to, yes, you need to assess this client. You got to assess this client for any adverse reactions, because this kind of mistake calls for further investigation of what is happening to that client. I know notifying that healthcare provider, it sounds like the best thing, because you can get orders from a doctor. You can get new orders from a doctor. But the doctor is going to need information, and you have that information. That's one thing that nurses, no matter what kind of doctor it is, a nurse always will have 2 advantages over doctors. Always. We always have the advantage of more information and more time. We know any day a nurse that's caring for a patient will know more about that patient than the doctor. I don't care. So the nurse, we know what's going on with the patient. We know their current condition. We know who visited them today. We know if they got any phone calls, if they walk down the hall. We know who the doctor is, the dietitian. We know how much they ate at their last meal. Nurses always will have the advantage of information over a patient when it comes to the doctor. So even if you call a doctor up and say, hey, what's the next move for me? The doctor is going to say, hey, I need some information for you. You're the one with the information. Tell me what's going on. So always remember that. Another thing that we will have along with information is time. We have the advantage of time. Doctors cannot sit in the patient's room and just sit there and go over them with them. Most of the time, they're in a room for how long? Very short periods of time, and they have to move on. And honestly, from my experience in teaching hospitals, when a doctor comes in, he's coming in with 5 other, interns, and he spends more time talking to the interns than he does with the patient. So he'll ask the patient, hey, how's it going? How do you feel today? Good. And then he'll turn and talk to the doctors, the other doctors, and say, well, this patient has a history of this, and this. And so we need to be mindful of these things when we're Like, not even explaining these things to the patient, but to the other doctors. So we as nurses, we have the advantage of time with our patients, and we have the advantage of more information. So when you call a doctor, make sure that you have that information in your hands. And in my personal practice, if a doctor calls me, and this was back in the day when we had physical charts, before we had Epic and all these other things, I would grab the chart before I got on the phone. I'm not talking to you without a chart in my hand, so you can ask me some question I don't know the answer to. So I would go grab a chart, or I would go to a computer station, pull up the patient's chart, answer the phone. Hello, this is Regina. Let's go. Like, what you want to know, I'm going to find it and I'm going to give it back to you. So that's the kind of mindset you have to have with that. Okay, I'm off my hobby horse about that. Let's do the next question. This is Let's Talk NCLEX. So question number 3 says this, ladies and gentlemen. The female home health aide calls the employee telehealth nurse and reports shoulder pain after giving a bed bath to a client. Which priority action should the telehealth nurse tell the home health aide to take? All right, here we go. You guys know the situation. Here are the options. Explain how to perform isometric exercises. Instruct her to go to the local emergency room. Tell her to complete an incident report. Recommend that she apply an ice pack to the back. So here we go. Number 1, explain how to perform isometric exercises. 2, instruct her to go to the local emergency room. 3, tell her to complete an incident report. Or 4, recommend that she apply an ice pack to the back. All right. So the priority here is what, ladies and gentlemen? And remember, guys, we want to work on reading for understanding. Reading for understanding. So that means answering the correct question to what you're being asked. That is going to be a fundamental practice for you guys. All right. So the correct answer, I see the answers coming in. I see that most people, where are you guys picking? Most people, okay, 3, 4, 3, 4, 2, 2, 2, 2. Okay, the correct answer, here we go, is recommend that she apply an ice pack to the back. This is the priority nursing action for this is the priority. This is the priority, okay? And this is the reason why, because what did the question say? The question said that the nurse's aide was calling into the telehealth nurse for what reason? Because she had back pain. Was this back pain a mysterious back pain that, she didn't know, that didn't come from any direct cause? No, we're given information that this back pain came from her giving a client a bath, right? So sometimes that can happen, right? Being a nurse, working with patients, it's very common that you can have a back strain, right? That you can have some muscle soreness from doing an activity like that. So the prudent thing for the nurse to tell the home health aide to do would be to apply ice to the area that you're experiencing this muscle strain. All right, so let's look at the other choices, shall we? So the first choice was to explain how to perform isometric exercises. At this time, this is not going to be the priority, okay? Because this nurse is in pain. She's not going to want to listen to a nurse explain over the phone how to do exercises. 2, instruct her to go to the local emergency room. This is not going to be the best thing for the nurse to do because, number 1, is this an emergency? This back pain from giving the client a bed bath. No, not on the onset. This is not an emergency that we would have somebody sitting in the emergency room for. we have information about, as nurses, we have information how to treat muscle strains. Telling her to complete an incident report. This might be helpful for her to do if she wants to put it on record, but it's not the priority over putting ice to the back, because that is what she's actually calling in for. So you would want to address that. Okay, Remar nurses, last question before we look at the share goals, if we made it or not. Question number 4. I think you'll like this one. This is thinking. This is a critical thinking one for you guys, and it's really good. So we have the surgical unit has no scheduled procedures and is overstaffed. There is a low census with only 4 clients. Which staff member should the nurse supervisor notify first and request to stay home? Okay. So surgical unit, low census, only 4 clients. Which staff member should be notified to stay home? Okay. Is it number 1, the nurse who has the most vacation time? 2, the nurse who requested to be off? 3, the nurse who has the least experience on the unit? Or 4, the nurse who has called in sick the previous 2 days? Oh, this is a good one. I'm going to read you those choices again because you probably need more time to think. Who should be requested and notified to go ahead and stay home? Is it number 1, the nurse who has the most vacation time? 2, the nurse who requested to be off? 3, the nurse who has the least experience on the unit? Or 4, the nurse who has called in sick the previous 2 days? Oh, this is a good one. What should this nurse do? Oh, this is so tough. This is so tough. And this is all about whether you're able to apply basically fundamental. Oh, I don't even want to say that. I don't even want to say that. I just want to know if you can figure out it. And if it's not, it's okay, because we're going to go over it. The whole reason that you are here is because you're interested in learning. At the end of these programs, you want to be changed for the better. You want to feel like you walk away knowing more than what you came with. And that is okay. That is just perfect. That's just perfect, guys. Okay. So wherever you are, you're sticking to plan A. Let me give you the correct answer. The correct answer here is going to be, you might have guessed it, number 2. So you want to give off to the nurse who desires to be off. That's just as simple as it is, okay? The nurse who has the most vacation time, maybe she's saving that vacation time for something special. I don't know. She has not indicated that she would like to be off at this point. The nurse, number 3, the nurse who has the least experience on the unit. Well, if you're giving that nurse time off, maybe she won't get the experience she needs. Maybe she doesn't have time off to give, and then the person who called off sick the previous 2 days, there's no reason for that person to be given time off unless they're sick for another day. So this might have been a tricky one. But hey, you know what? It is all good. It's all good. And just in this instance, you guys will remember, if you see this on NCLEX, to give off who says they wanted to be off, period. Okay? All right. Hey, are we at our share goals? We asked for 100 shares, and this is where I stall so you guys can share this video. But don't forget, I want you to sign up for Remar Nurse University. It's back. And also tell your nursing student friends or those that you know who are interested in nursing that, you know what, it's time. It's time for you to get into nursing school. And one of the gatekeepers of getting into nursing school is that TEAS exam. Nursing schools don't want you in their classrooms if you cannot figure out, and this is so silly, if you cannot remember the stuff that you learned in junior high. Okay, so you have to be able to read at a certain level of comprehension. You have to be able to know your science and your anatomy. A big part of TEAS is just knowing the anatomy. What is the circulation of blood? How many organs do we have? Like, how many kidneys do we have? You know, and stuff that's really easy to us. For those who don't have the training, it's very difficult, and they don't remember, like, what is the function of the bladder? Does it hold urine? Does it hold blood? Some people, they need the refresher course in order to know these things. So you'll be able to encourage them. Once your friend gets into nursing school, you'll be able to help them to study, and you'll be a true resource to them. So. Did we make our share goals? Facebook, YouTube, did we get it? Did we do it? Oh, I think we did. We only needed 100. I'm waiting for Mark. He is not paying me any attention. He's not looking at me. He's busy working. Okay, so I'm going to keep going. Let's go. We did it, guys. We did it. Let's go. Okay, so let's do question number 5. Woo! It says, the wound care nurse is preparing to change a dressing. Which task should be delegated to the UAP? That's the unlicensed assistive personnel. Select all that apply. Number 1, turn the client at least every 2 hours. 2, encourage the client to drink a boost shake. 3, apply wound debriding lotion to the skin. 4, position the client's heels off the bed. Or 5, place a Posey vest restraint on the client. Which of the following should be delegated to the unlicensed assistive personnel? And remember, guys, with this, it could be one or it could be all of the options to be correct for this. Yeah. One or all of the options can be correct here. Which one would you guys say that it was? Okay. This is a select all that apply. But you know what? With these questions, they are content-based. So go ahead and put down your content there. Okay. And I'm going to give you the answer. I'm pulling up that answer right now for you guys. Let's do it. The answer to this select all that apply question was number 1. The unlicensed assistive personnel can turn the client at least every 2 hours. Yes, have them to do that. It is also okay for your unassisted, unlicensed person to encourage the client to drink a boost shake, because those are good for you. And we should have them to do that. Also, position the client's heels off the bed. Yes, the positioning can be done if taught by the nurse how to do that. That can be done correctly by an unlicensed person. Let's move on. Question number 6. We got it. You're doing good. Guys. This is the tough part. Just showing up. Showing up is the tough part. Here we go. Question number 6. Oh, this is a good one. The nurse is teaching a conference on acupuncture, a traditional Chinese medicine considered a complementary alternative medicine. Okay. Which client is most appropriate for this therapy? Talking about acupuncture. Number 1, the client who is diagnosed with a right leg thrombosis. 2, the client who is diagnosed with Alzheimer's disease. 3, the client diagnosed with asthma. Or 4, the client diagnosed with osteoarthritis. Here we go. Which one? We have the client who is diagnosed with a right leg thrombosis. 2, the client who is diagnosed with Alzheimer's disease. 3, the client diagnosed with asthma. Or 4, the client diagnosed with osteoarthritis. who is going to be most appropriate for acupuncture? This is tough. This is tough, but think about how it works. Kind of think about how it works, and then, like, all right, is it going to work for me or not? Is it going to work for this condition or not? Okay. So thinking about acupuncture, this is a complementary medicine that is going to work best for number 4. It's going to treat pain. It's going to treat pain. In general, you don't want to use complementary medications for like medical emergencies or really acute problems. Like, so the client with the right leg thrombosis, this client needs a clot buster that's going to get in there and break down that blood that has become like hypercoagulated. The client with Alzheimer's disease, you don't typically want to use acupuncture for mental illnesses, especially progressively severe ones, and also for asthma as well. We know the type of medication that client needs. So we're going to be very, very careful about that. All right. Now, let's talk about number 7. This is Let's Talk NCLEX. Final question coming up. Let's give it a try. All right. This is a lengthy one, but it's a priority. So which client should the nurse plan to see first? And we have number 1, 51-year-old client diagnosed with multiple sclerosis who is reporting a cough, fever and cough. 2, 38-year-old diagnosed with congestive heart failure who reports losing 3 pounds. Number 3, the 22-year-old client diagnosed with a L5 spinal cord injury who has developed a stage 4 pressure ulcer. Or 4, a 48-year-old client diagnosed with a cerebral vascular accident who has left-sided paralysis. Okay. So, who should that client see? Who should the nurse see? Which client should the nurse see first? Okay. Who do you guys think that it is? Who do you guys think that it is? A lot going on here. A lot going on here. Number 4s. I see a lot of number 4s. See a lot of number 2s. This client has the airway, congestive heart failure, might have some shortness of breath. I don't know if it's right-sided or left-sided. Somebody who has a paralysis injury, they now have a stage 4 pressure ulcer. Somebody with multiple sclerosis, they have a degenerative neurological issue. What is going on and who needs to be seen first? You guys are doing a good job. I mean, I love it. You guys are just going with your first mind. Go with your first mind and put the answer down. That's all you do. Put the answer down. Turn on your notifications too. So every time I go live, you hear that bing, you hear that bell sound, you know that it's me. All these things are important. Let's do it, guys. And I'm going to give you the right answer here. You may be shocked. You may be shocked. You may be shocked, or you may not be. But the correct answer is going to be, hey, it's number 1. 51-year-old client, you got it, diagnosed with multiple sclerosis. You did it. You did it. Yes, this client, the immobility of this client, the complications of this patient, we need to know, why do they have a fever and a cough? Do they have some sort of infection? Is this pneumonia? If this is pneumonia, oh, it's going to be bad, right? For my patient with multiple sclerosis. If it's something else, I just need to know, because this patient is the most severe at this time. He needs some more assessment. What is going on? The 38-year-old client diagnosed with CHF, they're losing weight. So that's good. That means that they're probably responding to the therapy that they're on, right? And then we have here the patient. Who do we have next? We have the patient with the spinal cord injury. They just have the stage 4 pressure ulcer, right? So we expect somebody that's not being turned appropriately to begin to have skin breakdown, especially if you're paralyzed, you can't move yourself. So if you think about the pressure ulcer, it's not a medical emergency. We know what it is. We know what it comes from. So we're at the intervention point for that patient, right? But the patient number one, they're at the assessment point, right? So that's the beginning of the nursing process. And then the client who had a CVA and they have some paralysis, well, that's congruent with their condition. So it doesn't seem like that's a new condition that needs immediate investigation. But that client with multiple sclerosis who has a fever and a cough, that patient does need some investigation. Hey, how did you do? You know what? 3 out of 5, I'm happy with today. The questions were critical thinking, but they were also a lot of fundamentals today too. I really want to work on with you guys just making sure that you're reading the question appropriately, that you're answering the question that is presented to you, because I think that is going to help you greatly when you take your exam. So we're here to help you. We want to be the help for you guys. When people think of Remar, I want them to think of, oh, they believe in me. They can help me, because that's how we feel around here. So the idea is you need to believe to achieve. You need to believe to achieve. And I'm believing in you guys. I need you to believe in yourself. Don't forget, Remar Nurse University is back. Yes, we're doing a back to school event. And it's going to be, don't forget, the time and place and date is September the 15th, right here in my hometown, Youngstown, Ohio. That's Northeast Ohio. So if you are in the area, you're going to be signing up for this at remarnurse.com/RNU. Plus, don't forget, we're online streaming this event for free. And once you sign up for the event, you'll be able to get the times, the location, also the workbook, most importantly, so that you can keep along with me. I can't wait to meet you guys. I can't wait to do this event and just educate, and also let you know what amazing new things that we have coming up right here at Remar Review. So stay tuned. Don't forget, guys, here at your family, we always say this. We say email us at support@remarreview.com if you have a question. We love to hear from you. But then after we say that, we say we can, we will, and we must pass NCLEX. See you guys later. Bye.